This is Eyewitness News, the news leader, with Phil Lipoff and Michelle Charlesworth, Jessica Taft with sports, and Jeff Smith with the exclusive AccuWeather forecast. Now, Eyewitness News, Saturday morning.
Patient empowerment. We're joined by a local doctor with some tips for helping you let your doctor know when your symptoms are real. Straight ahead on Eyewitness News Saturday morning. Advice for the best way to communicate your aches and pains to your doctor. We are joined by a local expert. When you're just not feeling well and want to go to a doctor, for some people, sometimes it's hard to explain exactly what's wrong, and that could lead to a misdiagnosis. Well, joining us this morning with some tips to help your doctor help you is Dr. Benjamin Natelson. He's author of Your Symptoms Are Real: What to Do When Your Doctor Says Nothing is Wrong with You. Good morning, Dr. Natelson, and thank you for being with us this morning. Now, let me ask you first off, what is the biggest challenge a patient faces when going to the doctor with an unknown illness?
Well, of course, it's not unknown until the patient goes to the doctor and the doctor tries to evaluate what it is and does a lot of tests. But when time passes and the doctor sort of starts doing this, then, of course, the patient is falling between the cracks of classical medicine. And then there can be problems. So the patient really has to try to keep finding a doctor who'll be able to communicate with her. And I say her because unexplained symptoms are more often women than men.
Oh, so you have to keep asking and switch doctors if you just feel uncomfortable with what they're saying or what they're not saying to you.
Well, if you don't get an answer, if someone doesn't say to you, well, this is what your problem is, and let's come up with a way to help you feel better, yes. I mean, you as a patient are an economic force. You have a right to find a doctor who will sit and listen to you. If you have a new problem, you go into a doctor's office and 30 minutes later you're out the door without any solution, that's a problem for everyone.
Right, you have to kind of take control of the situation and handle it for yourself. Now, one of those difficult diagnoses you talk about in the book is fibromyalgia. Tell me why that's so.
Well, fibromyalgia and chronic fatigue syndrome, the two illnesses that I'm an expert in, are illnesses that don't have any abnormal lab tests. So people have complaints, and doctors are taught to look for abnormalities. They're taught to look in your throat for a big red throat. They're taught to do blood tests to look for abnormalities. And if they don't find any of them, again, there really isn't an algorithm, and then the patient falls between those cracks.
Right, and that's not good because, like we said, a misdiagnosis, and you can get worse with whatever is ailing you.
Sure. Now, fibromyalgia is pain all over, widespread pain with tenderness. So when the doctor palpates various areas, the person's tender, and it's pain, and then there are problems with sleep, of course, because if you're in pain all the time, you don't sleep well. When you don't sleep well, you start having troubles with concentration, that sort of thing.
Okay, so do many of us really need to be concerned about maybe our doctors not listening to what we're saying?
Well, that's, of course, can be the problem. The economics of medicine is that it has to be simple. And if it's not simple, that's a problem. And then when patients complain about pain and fatigue, everyone has aches and pains, and everyone is tired. So doctors tend to zone out. So this can be a problem. But, I mean, that's really the reason I wrote my book, to provide people a way to wellness, because there are things that you can do yourself as well as asking your doctor to help you with medicines.
Right. And so if you've got that itchy feeling that you know there's something wrong, but your doctor's not seeing it, and you like your doctor, you want to stay, how do you convey that message? How do you say, hey, listen to what I'm saying?
Well, sometimes it won't work, and then you need to get referred up the referral ladder. And people with pain often go to rheumatologists. Rheumatologists are doctors that know about the joints and muscles. But the problem is that the fibromyalgia is not a disease of the joints and muscles, and so rheumatologists often have problems knowing how to manage pain. So now I'm here at Beth Israel Medical Center in the pain group because fatigue and pain go hand in glove.
Right. So ask questions.
Absolutely.
Dr. Natelson, thank you so much for being with us today.
Thank you.
And we put these tips on our website, 7online.com. Click on the See It on TV link in the upper right side corner of the page, and you'll see weekend morning interviews and tips.